My name is John Painter. I'm a consultant gastrologist and I've been in post in Sunderland for over 20 years. I'm a clinical director here at Sunderland and I now work as part of the South Tyneside and Sunderland NHS Trust, and that incorporates the gastrology departments both at South Tyneside and Sunderland. I'm also the upper GI cancer lead across the trust on both sites. The recent NICE, as in NICE guidance, has made the referrals for suspected upper GI cancer much easier. Now the only two criteria for esophageal gastric cancer is if you have dyspepsia or upper abdominal pain with associated weight loss, or the second criteria is if you have dysphagia. So previously, NICE suggested that new onset indigestion in people aged 55 and above was an urgent criteria, but the latest research shows that the incidence of cancer in such patients is low, meaning 1 in 100 or less. Therefore, such patients do not need referral urgently on a 2-week cancer referral pathway. When we receive such referrals, we will screen them daily, and this is done by consultant gastroenterologists. And we then, based on the information within the referral criteria, will often bring patients direct to test to shorten the time to diagnosis. And such patients are offered either a gastroscopy, particularly if dysphagia is the presenting symptom, or they will be offered a CT scan if abdominal pain and weight loss is a predominant symptom, and sometimes we do both because we're not sure which is which. In patients with jaundice, we'll often order a first direct test CT scan. Patients are then contacted with the results, and we will do this either over the telephone or in a fast track clinic to let them know the results. We do our very best to try and tell the vast majority of patients they do not have cancer within 28 days, and we try to do it even sooner if at all possible. For those patients with cancer, we arrange an urgent outpatient review, usually face-to-face, but of course we'll always respond to the individual wants and needs of patients, so sometimes this is done on the telephone as well. Ultimately, these patients will be offered urgent staging scans, and if found to have potentially curable disease, will be urgently referred up to the regional centres in Newcastle, namely the Freeman Hospital if they have potentially curable hepatobiliary malignancy, or to the RVI if they have potentially curable esophagogastric cancer. All cases are discussed in the local MDT, and we only refer patients who have potentially curable disease up to the regional centre in Newcastle. All palliative care is performed locally, be that palliative chemotherapy, or end-of-life care, or endoscopic stenting, etc. Or potentially curable disease is automatically urgently referred up to Newcastle to do our very best to get these patients their potential curative treatment, and to do so within 62 days in line with the national standard. Unfortunately, the complexity of upper GI cancer means that some patients require multiple staging investigations, and therefore not everybody is offered their urgent potential curative treatment within 62 days, but between ourselves and Newcastle, we strive to do our very best to deliver this in as many patients as possible. It is extremely important for us that all clinical details are filled out on the referral form so that we can make an accurate judgment as to whether or not it is in the patient's best interest to come direct to tests such as gastroscopy, or whether the patient would benefit from a review in a clinic beforehand. We require these details to deliver safe care, so please fill out the form completely for us. The NICE criteria for hepatobiliary cancer is broken down to two major criteria. The first is if you have upper abdominal pain and weight loss, where we might be worried about pancreatic cancer, and in such patients we'll often arrange a direct to test CT scan. The other is if you develop jaundice over the age of 40, which is usually painless, but we'll also consider referrals where the jaundice is associated with pain. For such patients, we will usually arrange a direct to test CT scan, again unless there's uncertainty about patient frailty or about patient wishes. It is very important for all referrals that patients know they're being referred for suspected cancer, and not to be surprised if we organise a test as their first point of care. It is really important that we tell the 9 out of 10 patients who do not have cancer that there is no cancer present, so we can relieve their anxiety and they are able to get on with their lives without worrying about the possibility of cancer. In the 1 out of 10 patients who unfortunately do turn out to have cancer, we also need to clearly inform them very quickly so they know what's going on, and arrange the very urgent staging test to see whether or not they have curable disease. For patients who have potentially curable disease, we will refer them up to Newcastle, to the Freeman Hospital for surgery if they have hepatobiliary cancer, and to the RVI if they have esophageal gastric cancer. Sadly, as you know, most patients do not have curable disease, and palliative treatment is offered locally in Sunderland and South Tyneside. Ultimately, if you're not sure whether a patient has symptoms warranting a suspected cancer referral, then please feel free to email us on the NHS advice and guidance service, and the consultants will email you back within 24 to 48 hours with advice as to what treatment to be given in the community, what investigation in the community, if any, are required, or whether the patient should be referred urgently on the to suspected cancer pathway. Ultimately, we're here to give advice and guidance, and ultimately we're here to hopefully to offer extremely good, rapid care to our patients in line with what the individual patient wants. If you have any cases where you're really uncertain what to do and you would like further advice, please feel free to email me personally or to contact me via the switchboard here at Summer Hospital or one of my consultant colleagues, and we'll be more than happy to answer your queries. We're here to work together for the best interests of patients and to support each other, so please feel free to contact us. Thank you for all the good work in the community and everything you do, and please use us as necessary to help yourselves and to help the patients as best possible.